Assalamu alaikum. Welcome back from the ad break. You are still watching Prime Life. Now, we are looking forward to a very fantastic interview with Saadiyah Sayed, and we will be discussing World Prematurity Day. That was on the 17th of November. Now, this evening, we will be talking to her because she's a doula and also just because of World Prematurity Day, this day is also dedicated to raising awareness about premature births and also the challenges faced by preterm babies and their families. Now, Sadia will also be sharing with us her insights on preterm birth, its impact, and how we can support families who have, premature babies. And also, we want to also learn about this important topic together and just tackle a few things that we might not have been aware of. Thank you so much for joining us, Sadia, and welcome to Prime Life and Assalamu alaikum.
Wa alaikum salam. Jazakallah for having me.
Jazakallah so much. Now, before we actually delve into, the topic itself, which is about, premature babies and how we can also learn about this important and crucial topic, can you maybe take us through when you started becoming a doula and what actually sparked the interest in this specific field?
Sure, no problem. So I actually started off my career by wanting to complete my nursing, but unfortunately I couldn't do so because of the hours, etc., etc., and because I myself had had premature babies. I only started my studies after I got married and after I had my children. And all three of them, my son and my set of twins, were all very, very early premature babies, which needed me to be there for them, close care, etc. And this is when I started my career as a doula, where I then shifted the nursing career and then started doing my doula career, where I realized that women need support, not only during the birth process, not only during the postpartum process, but also being a mom that experienced babies in the neonatal ICU, having that support, having people, having like-minded people in the same in the same space as you, and also just having specific people like doulas, like midwives, support you during this process. It's a different world having babies premature, having to go to the neonatal ICU every day after you've given birth, barely recovered, is a different world to be in. So this is where it sparked off for me to actually start my doula career, where I then started assisting mums. But then I started off at Rahima Musa Mother and Child Hospital. I started volunteering there, and then I moved on into private practice, and then I opened up my own doula facility, my own doula training facility. This is my second year now, alhamdulillah, where I aim to encourage young girls to become doulas, where they can assist women in government facility, in private facility, just so that the transition into motherhood and postpartum can be
Mm,
a smooth one.
mm, mm. Most definitely. Thank you for sharing that with us. Now, just to delve into the topic itself, can you tell us what are the causes for premature birth and, how common is it actually?
It's also known as premature birth, is also known as preterm birth. So this
Mm,
usually occurs before 36 weeks.
mm,
Over 50 million babies are affected worldwide.
mm,
1 in 10 births are premature babies. So this is something that is recognized worldwide, and this is why it's called Worldwide Prematurity Day, where babies are born premature. And unfortunately, in our rural areas, there isn't neonatal ICUs, there isn't overhead monitors for these babies to support these babies, to assist these mums, and that's why there's so many deaths of premature babies. So this is a worldwide effect that affects parents
mm,
every day. Yes.
mm. Thank you for sharing that with us. Now, I want us to talk about the risks and the challenges that are associated with the preterm babies.
So, because they're so little, their respiratory issue is usually immature. So,
Mm,
they do have respiratory issues where some babies would just need oxygen, some babies would have to be put on to ventilators. And then you find that later on, that there might be like sort of cognitive development issues where parents are encouraged to go and see OTs where they can help develop these babies better, depending on how premature the baby was. So sometimes babies are born as early as 25 weeks onward. So depending on, the condition of the baby when the baby was born, also the infection rate is high because they become susceptible to infection because of the immune system being so minimal when they're born. The immune systems are definitely compromised when they're born so little. So yes, it's mainly the respiratory issue, the cognitive development. Sometimes brain development, there is an issue with brain development where they would need like further investigations to see if it was properly developed, if everything is okay. So this is why these babies would then be put into the neonatal ICU, where they would have close care from pediatricians, pediatric surgeons,
Mm.
etc., etc.
And I want us to also speak about, preventative measures for is there anything that expectant mothers can, do to prevent themselves from finding themselves in a situation where they've got a premature baby?
So sometimes premature births would just happen without any cause, without any reason, where
Mm.
mums would just go into spontaneous labor, where their membranes would rupture, or they would just start experiencing contractions and, without any explained reason. And some mums would then, sometimes where they suffer with high infection rates, if, like I said, if they go into spontaneous labor, their lifestyles, if they're abusing like drugs, alcohol, etc. Also, if mums sometimes have very high diabetes, high blood pressure, sometimes if they've experienced trauma during their pregnancy, this can also cause preterm labor. So your lifestyle is important with regards to carrying your baby to term, but sometimes it's unexplained. It's something that can't be explained as to why moms go into preterm labor.
Mm. Most definitely. And can we give advice to, families on how they can cope emotionally and practically with a premature birth?
So a premature birth is always unexpected because, we have an expected due date of 40 weeks. And as parents, this is what we always look forward to, or this is what we know. We're given a certain date during our prenatal consultations from our midwife, from our gynaes. And this is what we like sort of base our life around. This is what we work around. Okay, our baby will be arriving in 3 months' time, 2 months' time. So it's about, wrapping your head around your baby arriving early. Then it's about having to go to the neonatal ICU every day, especially if a mom has experienced a C-section, which is regarded as major surgery. So it's very difficult for this mom to stay at home, to rest, to recoup, to sort of get her strength and energy back because she has this little baby in the ICU where she obviously feels, the need to go there and be with her baby and express and have to feed her baby breast milk instead of them feeding their baby formula. So, with regards to having a premature baby, it's important that we support each other. We get support from family. If we have other children in our household, have other family members come over and assist us with our other kids, with our other household duties, etc., just to make that easy. Because personally, I would find myself when I gave birth to my twins, I would spend the entire day in the neonatal ICU, although I had a 4-year-old at home. So I would have to get my mom to come over and see to my 4-year-old just so that I could be there with my twins, expressing, doing skin to skin, because lots of skin to skin, lots of kangaroo care is extremely important for growing these babies, even though they're in the neonatal ICU, making sure that we do lots of skin to skin because we would just regulate their heart rates like that. We would regulate their temperature. We would relax them. It has so much benefit when we do it to a full term baby. So when we do it to a premature baby, it's very helpful. So if the mom can't go and spend time with this premature baby, for the dad to go to the neonatal ICU, spend time with their baby, hold their baby skin to skin, is of utmost importance. And also that separation as a mom and a dad, when you become parents for the first time, that separation from your newborn baby is very, very difficult, where you have to leave the hospital and go back home, and you know you have this little baby that needs close care, that needs so much of love, so much of care, so much of attention, and then you have to leave these babies in hospital. I find that that part is extremely challenging, and where mums can't almost manage that or deal with that during the postpartum period. So lots and lots of support when dealing with a premature baby.
Mm, most definitely. And what's one key takeaway or message that you'd like our audience to remember about premature birth and also World Prematurity Day?
Okay, so World Prematurity Day is a day that's it's worldwide. It affects 1 in 10 babies. There's lots of support in our country specifically with the neonatal ICUs. We have amazing pediatricians, amazing pediatric surgeons. But if you are, or if you do have a baby that's premature, make sure that you get enough assistance, that you get enough help, close care. So when you bring your baby home, making sure that you keep visitors away that's not well, around your baby until we build this baby's immune system, until this baby is strong enough to actually see people, and so forth. So getting lots of support, getting lots of good support is important. Taking one day at a time. The thing is with premature babies, sometimes you leave in the evening and go back in the morning, and then they found something in the evening, or the pediatrician or the pediatric surgeons have found something. So, taking one day at a time. Every day is a step forward for your premature baby. Some moms spend up to 5 to 6 months in the neonatal ICU. It's a very, very long time to spend the first few months of your baby's life in a hospital. So, again, lots of support, making sure that the mom is also seen to. If she's not feeling okay mentally, physically, emotionally, get help from your midwife, get help from a doula, from your gynecologist, and support each other as a couple, be there for each other as a couple. And yes.
Mm. I mean, thank you so much, Sadia Sayed, for joining us and just for, educating us on premature birth and, how families and friends can seek support during, this time and, exactly the challenges that actually can arise with a premature birth. So thank you for the insights and just for sharing your expertise in such an important topic.
My pleasure. Jazakallah for having me.
You are welcome, viewers at home. This was Saadiyah Sayed, who's a doula, and we were talking about World Prematurity Day. That was on the 17th of November, and we were just discussing the challenges and all things that have to do with premature birth, what to expect, and how to also be there for those who are affected by it. But on that note, it's time for us to head over to a quick break. We'll see you right after this.